Sophia, one of the questions that we keep hearing about regarding the coronavirus is care and different levels of care. And we know that one of the first confirmed cases of coronavirus in South Carolina was a Kershaw County woman who ended up needing to be transferred to a much larger hospital in the Midlands that was better suited to give her the level of care that she needed. Many people who don't have a family doctor go to urgent care facilities when they get sick. But medical experts tell me you should make a call about your symptoms before you ever go to the doctor's office so they can advise you on what sort of medical intervention is needed. Smaller community doctors like Dr. David Wright are making preparations for anything from the flu to coronavirus.
With coronavirus, we, just history taking, any travel, the symptoms specifically for very sick patients with coronavirus is high fever and lower respiratory symptoms. But of course, the flu is way more common. We see there's been 20 million flu cases this year approximately. But if someone does present here, we notify DHEC. We have sort of a system in place.
Depending on the severity of the symptoms, you may feel like you need to be treated at a larger hospital like MUSC. Dr. Robert Ball says they are well prepared and offering guidance to smaller practices.
Most community physicians and their medical practices have to learn more about coronavirus in order to screen patients. Please don't let patients walk into your office with the major symptoms of fever, cough, and shortness of breath because they may have coronavirus.
Dr. Ball's best advice for healthcare providers is to come up with a system they follow each time when handling a patient.
Set up a little small algorithm that is simple. Call, tell them what your symptoms are, have your frontline staff ask if they've traveled or been around people with flu-like symptoms, and if so, come in the back door, give them a mask, have one healthcare worker with a mask, do the initial screening per the CDC protocol.
Doctors have been stressing to me the importance of staying calm. There are lots of different ways to get care, even some of them from your own home, like MUSC's new telehealth free virtual healthcare program. And we have all the details and information on how to access that over on our website, counton2.com. For now, reporting live in downtown Charleston, I'm Hannah Powers. Count on 2.